Welcome to Grit, Grace, and Resilience. I'm your host, Michelle DeGrange. I'm a corporate leader, mentor, life coach in training, and a mom to what feels like 37 kids. Just kidding, only 6. Apparently, all that qualifies me to overshare on the internet. Every one of us has a story of overcoming, and this podcast is here to dig into those and talk about life and what overcoming with grit, grace, and resilience looks like. If you like things a little messy and sometimes a little unhinged, you'll fit right in. Welcome. We're glad you're here. Hello, and welcome to another exciting episode of Grit, Grace, and Resilience. Today, I am so excited to get to bring Cheryl Fish to you and have a discussion about all the things that I have been down the rabbit hole about now for years. We are going to talk through women's health. We're going to talk about hormones. We might even get into a little bit of discussions about sex. So thanks for being with us. And today, Cheryl, who is a nurse practitioner in the health and wellness industry, who I have known in and about and around for a couple of years with a background in cardiology, which is how we kind of know each other. Cheryl, welcome. And I'm so excited to get to talk to you today.
Thank you. Thanks for having me.
This has been something I've been wanting to focus on and talk through for a while now. Mainly starting since I've had so many women in my life who have had so many similar struggles that I have had approaching 40 and then starting to just feel like I was sliding off a mountain and I just kept feeling worse and worse and getting more tired and chalked up to just part of aging and having kids. Until one day I was like, it can't just be this way. Like it shouldn't have to be this way, right? And I went clear down the functional medicine rabbit hole and saw multiple people and realized that I had to get educated myself and to take some into my own hands in order to start finding people who are interested in this stuff. So I am so excited about all of the work that you have been on this journey and progression into to help women in these arenas. Can you tell us a little bit about your journey and where you're at now and kind of what you're doing?
Absolutely. So I'm a nurse practitioner, and a few years ago, started Idaho Health and Hormones, and that was after our cardiology encounter. And it's been exciting. It was a lot earlier when hormones were not necessarily a trend. And
Mhm.
so it was still kind of new and exciting ground to break. We started with men and then started to transition into women. And so it's been fun to learn about hormone therapy and to really become more of an expert in the field. A lot of the times women are coming to me and with exactly the same complaints that you said. They don't feel good. The doctors are really kind of dismissing them and telling them that this is a part of aging and it's, just part of getting old. And a lot of the times that's so not the case. We have had so many positive experiences with hormone therapy, and we really see almost like a transformation of women and men in their 40s or perimenopausal, postmenopausal state where they start to learn to thrive again. And so it's definitely been an exciting adventure to be a part of.
So, what was kind of the tipping point for you? Was it that it kind of came out of your own personal struggle, or was it just that you just saw women feeling like they were drowning over and over and over and wanted to provide support?
Maybe a little bit of both. So cardiology was heavy. We see
Uh-huh.
patients all the time in the heart clinic that are, we'll call repeat offenders. They come in and they're sick, and a lot of the times we're adding another medication or we're trying to find ways to fix the problem currently. We're not doing a whole lot, unfortunately, to prevent. And so
Yeah.
it's a lot of band-aid work, and it's heavy. And so when an opportunity came to me to do hormone management, it was new, it was exciting. It's really fun to see what you can do for somebody and how you can change their lives. And so it really has shifted the focus more to just hormone therapy and now to living at your healthiest life and with quality of life. And really now the whole focus is shifting to even more so of like living with longevity. And so how can we live our longest lives and really thrive and be in the best state that we can possibly be in? And so it's been fun to see that.
I love the idea of getting proactive instead of reactive. Because I agree. I mean, I've been in medicine for so many decades now that it just seems like so much of what the focus is always reactive versus and I don't know what the statistics are as of recent, but when you look at like women and heart disease, I would assume, right, this idea of getting hormones aligned and looking at longevity and what we can do with all of this kind of biohacking and in this arena will change the trajectory of that and make it, proactive and our outcomes with already a higher incidence of heart related problems because of all the inflammation and all of the stress and the cortisol that this is what's going to change things. I mean, I even think about like for me, the trajectory of where I was kind of on 2 years ago and so rampant with inflammation and just stress that had that not changed, that would have been a completely different trajectory.
Yeah. And really what happens in that postmenopausal state is the estrogen production stops. And the estrogen is very, very protective of our bone, of our brain, of our heart, and just all the vasculature in our body. And so the loss of estrogen is where we tend to see accumulation of disease. And so we start to see more heart attacks. We start to see osteoporosis. And so it's really the estrogen. Now, other things can contribute to that as well, but the estrogen is a really key component to that. And even in the WHI trials that were, that really kind of unfortunately banned hormone therapy for a very long time, still had a positive effect on estrogen. It was, other factors that contributed to some of the scares that they
Mhm.
came out with. And so estrogen is very important for women in postmenopause to make sure that their hearts are protective and that they're not maybe predisposed to plaque buildup and things like that.
So, can you break down some of those myths? Because anytime you start saying hormone replacement, there's still a large subset of women who are still really afraid to even explore it. I mean, for me, knowing what I know now and experiencing what I know now, like, I mean, it is the difference between sitting in the dark and somebody turning the lights on when you've gotten to hormonal optimization post 45.
Yeah. So if you think about like if hormones are really as bad as we thought, then everyone would be getting hysterectomies at a very young age. I mean, we are producing
Right?
hormones through, you know, with our menstrual cycles and through pregnancy. I mean, there's all these hormonal shifts happening. And so if hormones were really that bad, then we would all be, all of our hormones would be taken away. And so progesterone and estradiol are bioidentical hormones. And so I really try to make sure that people who are undergoing hormone therapy are
Uh-huh.
staying on bioidentical hormone therapy. And then there's a lot of rules to it. I mean, menopausal women don't do as well with estrogen. You focus on symptoms with progesterone. Or postmenopausal women on estrogen should have a balance or what's called opposition with progesterone. So it is a little bit of fine tuning and just making sure that you're doing it in a safe manner. I
Which
see.
again is why that's so important to go to somebody who really knows what they're doing and who specializes it and has done lengthy research, not just took a class and I'm starting to do hormone replacement as well as, adding in all of the other co-facting factors. So when I think about like all of these women in my life who are stuck, where do they start? What are their symptoms they're looking for? Because so many just chalk it up to age. And we kind of as a society has made that acceptable. Like, well, you're just going to start getting tired. Or they've already gone to their OBGYN and they said, nah, your hormones are fine. You're fine. You're just, you're getting close to menopause and this is just part of it.
Yeah. A lot of the symptoms that we start to notice, especially in somebody who's perimenopausal, is maybe they'll start having some mild hot flashes or night sweats. Maybe their sleep has become disrupted. Maybe they're kicking their leg out when at night underneath their covers and they have their leg out because they're feeling a little warm. Maybe their periods are becoming irregular. Maybe they're feeling more moody or more irritable. So, I mean, those are a lot of the early signs. Irregular periods are totally normal in a perimenopausal woman. Menopause takes a full year of no periods in order to be considered menopause before we can truly classify, but there's some other things that we look at as well. But we do a lot of treatment based on symptoms. And so a perimenopausal woman who's having some hot flashes may be a great candidate for progesterone. Progesterone will help with sleep. Progesterone will help reduce those symptoms, will help with mood. And so progesterone is a great bioidentical hormone to have on board when you're going through that perimenopausal state. My mom is a great example. She started menopause in her early 40s and suffered for 20 years of hot flashes and night sweats until thankfully we came around and we got her on hormone therapy. And 20 years is too long. Like, she didn't need to suffer for 20 years of, she had the fan that connected to the bottom of the phone, and she had her little, the ones that you would open up, and it's just not necessary. So there's definitely ways to treat women in that kind of perimenopausal state when they're having those symptoms
When
without
when do you
well, I want
do
to
you recommend women? I mean, like I'm trying to think, like I feel like I didn't it didn't start with the hot flashes. It started for me, they got there. That's when I was like, "Oh, this is now I know what it
yeah.
is." But it was if I look back, I can think of like years of just starting to get more tired, not being able to build muscle like I used to because I would work out a lot, and there became a point at like, I don't know, 46, 45, where I just would work out and I felt like I couldn't build any muscle anymore, and I was just so much more tired.
So I think of that as a different symptom, a different treatment. For women who are struggling with fatigue, maybe they're struggling with some brain fog or just
Mhm.
clarity in their thoughts. Maybe they're struggling with muscle mass. I start to think more of testosterone. So testosterone is one of the most abundant hormones in our body, but yet it is looked at as a male's hormone. It is such an important hormone for women to have in different forms. It comes in injectables, it comes in creams, it comes in pellets. It's really more preference, but such an important hormone for women to have. And a disservice that it's not indicated for women, to be honest with you.
I think it's literally liquid gold and magic. Like
Absolutely.
my entire life turned around when I started testosterone. I tried pellets first and I couldn't get my levels to stay stable. So then I just went to injectable, but it literally reversed all of that. Like the inability to build muscle where I pre 46 could build a ton of muscle very quickly my entire life. All of a sudden I could lift for an hour and a half and I wasn't either able to maintain or even continue to build. And I was just exhausting myself. The first time I took it, it was literally within a couple of days, like someone had turned the lights back on and I could feel life breathing back into my body that I had felt like I was just slowly sliding down a mountain. So
Mhm.
will you start women on testosterone even before other hormonal replacement? So like at an earlier age then?
Yeah, I always am considerate of family planning as well.
Hmm.
But if we have a woman who, is done having babies and they're really wanting to focus on some testosterone replacement therapy, I will most definitely start them on it. A lot of the times, what we see as we'll call normal lab values are really truly not ideal for optimal care and for resolving a lot of the symptoms. And so, yeah, testosterone is a great one, fairly safe for the most part. I mean, really, things to be concerned about are maybe we get a little bit of extra whiskers around, we have some extra whiskers on our
Totally
face.
get that, right? A little bit of tweezers. That's why like tweezers in my house is like seriously, I'm over 40, do not take my tweezers.
Yeah.
They have to sit right by my mirror
Yeah.
every morning.
But I'll pluck all day long if it means I feel good. And so, and
Yes.
it's not just about the muscle. I mean, really what happens is you go to the gym, you work out really hard, you feel defeated. You're not making any gains, you're not seeing any results, and then you want to quit. And so
Mhm.
testosterone is really that motivation and that drive to keep you going. You start to see the gains that you're looking for, you start to feel more motivated, you start to feel better, and so it keeps you going. And really ultimately having more activities and being more proactive and doing things, that's really what's going to lead to longevity. I mean, muscle is fantastic. We need muscle. It's
Mhm.
important for our body. But having that drive to want to do things, plus it does have the benefits of libido, which is nice as well.
I love that you brought that up because when I think about it, like I know some women are like, "Oh, well, I don't want to take testosterone because I don't want to like bulk and get all bulky." I don't feel like that was any of the concern. It was more that like I could just continue to maintain and build again, but not to fear testosterone. Like it is it literally felt like my brains came back in my body and then I had stamina again. My level of fatigue got so much better. And welcome to post 40. And let's talk about sex drives and how for women, like we shouldn't just be put out to pasture and it should be something we talk about and that we don't just have to suffer all of these symptoms that start happening as we start getting closer to menopause.
Yeah. So anyone over 40 starts to experience what's called hypoactive sexual desire disorder. And really, this is just a lack of desire, a lack of drive. It is Testosterone is off label for this condition, although completely curable. And so a lot of the time, women don't want to have sex anymore because either they have pain or discomfort, um, or they have vaginal dryness that's causing their pain and discomfort, or they truly just lack that desire and that initiation to want to be intimate. And so testosterone is a great hormone to help facilitate and almost create like a bonding with your partner. So we have a lot of patients who have come in and they've told us like you saved my marriage.
100% believe that.
Yeah.
Yeah.
And it doesn't have to be anything what we would call super physiological levels where the levels are
Mhm.
so high that you start to see masculine changes or, bulking out or the deepening of the voice or other things that you tend to hear about when you think about testosterone. Women, we just need a little bit. We just need a little bit goes a long way. And so I think it's a very important hormone for us to have on board.
It's tiny, tiny amounts.
Yeah.
I mean, like I do twice a week injections and it's, 6 units, which is literally nothing, tiny, tiny. And yet it is so impactful. And I know there's a ton of myths, there's a ton of myths that keep women from using it. Can you debunk some of those, like as far as like I'm gonna I'm just gonna get bulk and I'm gonna start putting on all this muscle and my voice is gonna lower and I'm gonna like sprout hair everywhere. Do we even have levels for women? I mean, it seems like all of the levels for testosterone are still geared towards men. And is it just about how you feel? And that's kind of how you dose?
I think normal range, depending on which lab, is anywhere between 2 and 40. Women don't tend to feel good between 2 and 40. I mean, realistically, like my testosterone is 400, and that's where I tend to feel better.
Hmm.
I don't have masculine changes. I don't have voice changes. I don't, a lot of the times, and I don't know what I'm allowed to say on here, but a lot of the times are,
You can say everything in your head. I mean, this is such an important conversation for women, especially to understand that and debunk those myths that keep so many women from even seeking any kind of um, hormonal solutions because they just don't know, and it sounds really scary, and it's just not talked about enough.
it is not talked about enough. The black box warning, and I have to go back and look to see if this actually has been complete, but the black box warning said testosterone can cause heart attacks and strokes. I heard that this was getting updated and that black label was going to be changed. It's not
Awesome.
testosterone that causes heart attack and strokes. It's underlying diseases that are present
Mhm.
when starting testosterone that could increase risk for heart attack and strokes. Testosterone sometimes can cause what's called secondary erythrocytosis. So sometimes we see a little bit of thickening of the blood, but really it's a very safe hormone. I start women in their 70s on it and they feel fantastic.
Really?
And they're going to the gym and they're riding their bikes and they're swimming and they're doing all the things and they're enjoying life because that's really what it's about. It's about quality of life.
I love that. I think that is one of the most, I think, incredible gifts that you can give women in this day and age, especially where you're starting to see these mindset shifts. And with more education available, I think the more we can talk about this, the more that women can start to feel better and not be so afraid of it. Where is there any considerations? Like, I mean, I think that's incredible that you're getting women in their 70s to come in and start saying, like, hey, I felt so crappy for so long. Is there anything you can do? Is it just like even at my age where it's like the lights come back on and they're like, I have not felt this way in 20 years?
Yeah. And what I love about my older couples is I ask them to bring in their spouse because then I have to make sure that they're on the same what I call playing field and that their sex drives match. And so it's kind of fun to watch them like almost reconnect over time. So it's fantastic. And so most of the time, it's funny. I've seen more women recently in their 60s, late 60s, 70s coming in and almost having like a second menopause. Like they're all of a sudden experiencing hot flashes and night sweats and
Really?
along those
What do you
lines.
think that's from?
I mean, speculation, there could be some things in the food, there could be lack of exercise. I mean, there's a whole bunch of variables that potentially could be contributing, but regardless, we're still safely starting women in their 70s on hormones and they do fantastic.
So is there any like I remember a discussion and I thought, yeah, is that I remember asking myself if that was true or not and wanted to look into it further. How long can you stay on hormones? Is there a new update on that? Like it seems like in the beginning there was like, well, you can do them for a decade, maybe two, and then you've got to stop or remove them. Is that still true? Is that still the leading thought?
Technically, insurance wants you to stop hormone therapy at age 65.
Okay.
So women come to me and ask me, how long do I have to be on hormones? And I said, you get to be on hormones for the rest of your life because if you continue your hormone therapy, you continue to protect your bone, you protect the brain, protect the heart, build muscle. And so I don't think the increased risk is there over the age of 65. I mean, we have increased risks naturally as we age. We're more predisposed to falls and, to frailty and things along those lines. But the hormones should still be on board. So we get to take them forever.
Yay! Because I will be honest with you, like I was like, wait a minute, I don't want to ever. I mean, I don't want to stop. I don't want to feel absolutely. I don't want to feel like I'm sliding down a mountain again.
I
This
do
has
not.
been the best post. Now being 50, I feel better today than I did 10 years ago, which is incredible. Like I think it's so polar opposite of what everybody expects to happen to them.
Yes, and I agree with you. I don't want to feel any of those things either. I am just kind of starting my perimenopausal journey. Just my mom was a young in her 40s when she started, and I don't want to experience those symptoms. I don't want to become frail or become weak. And so everything that I prescribe, I try personally because I want to be able to speak to how my experience has been as well. And so I am with you. I don't want any of those symptoms.
So that's good news because I had heard that at a certain age you had to stop because there was an increased risk, and I can't remember if it was an increased risk of cancer or what it was, but that was about that same age. So you can just continue to take them, and then you've just got to have somebody that is very very educated to be regulating those over time. Now what else are you adding into that mix, like for women that are kind of going that that journey of trying to stay optimized? What else are you guys working on?
Hormones are just a piece. I learned that very early on when I started the hormone clinic is I could optimize hormones all day long, but that is just a small piece of the big picture. We focus on sleep because sleep is a very important process that needs to be looked at carefully and just making sure that we're resetting our brain and that we have all of the opportunity for our body to refresh. So sleep is a big one. Mood, because hormones obviously tie, if I optimize your hormones, but you're still lacking that maybe connection, then there's some things that we need to address with the mood. Gut, there, and we talked about inflammation a little bit. Inflammatory response starts in the gut. And so making sure that we have, healthy foods on board and just living the healthiest life through diet and exercise as well. So all of the staff are trained to really be an advocate, almost like your personal cheerleader to help people kind of stay on path. And we provide body composition assessments. So we're really looking at like visceral fat, bringing it back to cardiology. We're looking at their cardiometabolic risk factors. So what are the chances or probabilities of you having a cardiovascular event? Are there known plaque buildup that we need to be mindful of? We do calcium scores on a lot of our patients, especially if there's any presence of or any signs that we need to be mindful of. But we do body compositions to monitor visceral fat regularly, which is important. Everybody wants to lose weight, and which is a great thing, but if you're losing the wrong kind of weight, then we've done you no service. And so making sure that we're looking at things on the bigger picture is important.
I love that. That's such a holistic view. And it's hard to find holistic treatment. I mean, it seems like if you go somewhere you can fix one component, right? And but then it's still a host of and a cascade of so much else that I love that you guys are addressing sleep. And I feel like as we age, right, our I mean, that was happening to me. My sleep kept getting worse and worse. And then it is a cascade, right? Helping, increasing my mood and lability and all of it like just ties in together. So where do you start with people if they're coming in and say, is it just first optimize the hormones? That's what I've always been told. Like first let's get your hormones optimized and then start to work on all these different pieces.
That's exactly how we do it. Hormones are the easy solution to start with, and then we do monitor those to get them optimized. Usually around month 3, we'll know if there's still some symptoms that were not fixed with hormone therapy. And so, say for instance, there's
Pretty
still,
quick. I mean,
yeah,
that's a pretty quick turnaround, honestly, from going, I feel really horrible to I'm starting to feel better. I think anybody is happy with a 3-month
yeah.
potential turnaround.
I think 3 months is the most realistic. I mean, we can do some pretty good work within, a 3 to 4 month period. In fact, we do a progress report at month 4 that really kind of shows them where they started to where they are now. And so then if there's still significant underlying issues with sleep, I mean, maybe now the sleep is better, um, because we've corrected the hot flashes or night sweats, but they're snoring, and maybe we need to do a sleep apnea test. And so we'll send them for
Mhm.
a sleep study. Um, so there's a lot of things that we look at. We readdress things around that 3 month mark. I tell them 6 months. Like in 6 months, I should have you dialed in. That's
It's
the goal.
huge. I mean, honestly, for as long as it takes, feeling like you're sliding down a mountain and unraveling, 6 months is a pretty quick turnaround to have hope. And hope is such a powerful tool for women, especially as long as I felt like I was starting to make progress. And I love that starting with the hormones because I feel like you start to get a win. Like, okay, now I'm starting to feel better, which seems to encourage all of the other positive changes that you can start to make.
Yeah.
What are you trying to get as far as sleep when we talk about sleep? Like, what is the goal everybody's trying to get to? I feel like it becomes like a badge of honor. Like, oh, I can do everything on 6 hours. I am an 8 hour girl. If I do not get 8 hours, I'm an absolute train wreck.
I think everyone's a little different, honestly. I mean, I think our bodies
Hmm.
naturally within 6 hours, if we get good quality sleep, can do a lot of the restoration that it needs. But I think everyone is a little bit different in like what they need. I can operate on a little bit less sleep as long as my sleep is like really good, sound sleep. And so it all really kind of depends on the quality of sleep and, different variables with the sleep cycles as well. So that one's, some people want 10 hours.
No, I mean, I'd take 10 hours, I think, at this stage.
Now, if I sleep for 10 hours, I'll be a walking zombie. Like, there's no way I could do that. But I think people just need a little bit more sometimes.
What are your recommendations for getting better sleep? Because I feel like it's one of those things where you're like, oh, okay, is it just because I'm not going to bed early? Is it because of blue light? Like, do I need to be wearing glasses? Like,
All the things.
what are all the things?
All the
What are
things.
all the things?
I think social media has kind of taken a toll on our sleep habits just because, people lay in bed and they're scrolling. That's
So addictive.
That's so addictive. And then I notice, like, if it's later at night and I hear a song, then when I go lay down at night, then I hear the song in my head. And so it's
I'm
like,
so glad that's not just me. That is
no,
so frustrating.
it is
What
so
is
frustrating.
that?
So
It'll go for forever. For whatever reason, it's like this replay. That is the most frustrating thing.
it is. I know. I don't follow all the rules with, the glasses, but I do believe in going to bed early. Unfortunately, that doesn't work for everyone because we have a lot of night owls. But
Hmm.
there is something to say about going to bed early and getting that reset. I mean, I can go to bed at 9 o'clock and get a good night's sleep, and I'm ready to go at 4:30. And so I think everyone's different in terms of that. But if you can't get good symptoms have resolved, we'll resort to maybe some natural sleep aids if possible.
What are your go-tos? Melatonin?
I have a trio. So my
Okay.
natural options, and it really kind of depends. Are you having trouble falling asleep? Are you having trouble staying asleep? And so those are things that we ask in the clinic, and we need to know if it's falling asleep. There's certain things that will help. If it's staying asleep, there's other things that will help. And so sometimes It even resorts to going to a prescriptive option
Hmm.
if needed, because it is really important that we are resetting. So my natural options, I tend to do an L-theanine, a valerian root, and a melatonin. And
Okay.
sometimes as a cocktail. So we'll kind of combine those, especially for some of my really, really sleep deprived patients. Um, Other times we'll use maybe a low dose of trazodone if needed. And so I think it really just depends on the sleep issues, and those are different
Hmm.
across the board. But, don't eat heavy meals too late at night and
Right.
all of the rules that apply.
The sleep in a cooler bedroom, right?
Yeah.
I noticed that when I started doing that, that did help. Like when I dropped it down to like 66 for me, because otherwise I freeze to death. But I definitely have noticed that I do sleep better. And if I don't eat after like 8 or 9.
And if you've gotten good exercise for the day, if if your husband or spouse isn't snoring, like there's just so many variables.
That is such a hard one. I mean, I sleep with, have you ever seen the loop earplugs? They're these tiny little silicone ones because um I used to sleep with like the Max silicone ones and it was ripping out all of my hair on the side because it would get stuck in them.
Yeah.
So I found these ones called Loop and they make them for like concert experiences and all that kind of
Okay.
stuff. But they make one that blocks out noise pretty aggressively for sleeping. That is the only way that I can sleep. It is a crisis in my world if I do not have earplugs because of my husband's snoring.
Yeah.
Because there's some ridiculous statistics that I can't even remember off the top of my head, but I want to say it's like you lose an additional like 2.5 to 3 hours of night of sleep if you sleep with a partner who snores.
Well, and think about what snoring is doing. I mean, it's for your husband. I mean, it's one, they're not getting good quality sleep. Two,
Mm-hmm.
predisposes to weight gain, and
Mm-hmm.
even been tied to some heart conditions if, left untreated. And so, yes, for you as the recipient and for him as the
Oh,
as
I worked
snoring.
I worked in respiratory for years. So
Yeah.
I did the getting him to a sleep test and the pulmonologist that I knew at the time, he's like, "You're not going to believe this. He doesn't have sleep apnea." I'm like, "That cannot be true. There is no way." But his is so
Central.
much obstruction. Yep, and it's so much obstruction. I had him get a deviated septum. He was 90% occluded.
Oh yeah.
They could only get him to 50, so he still snores but wouldn't meet the criteria for insurance for sleep apnea.
Yeah. Sleep, there's a lot of contributing factors, whether it's obstructive, whether it's, essential, whether it's a structural defect, maybe our jaws are collapsing. There's all these things that could be happening. And so definitely we use something called SNAP, which is a at home sleep study. It's very affordable. And they deliver it right to your home. You get to do the sleep study in your home, in the comfort of
Awesome.
your own bed. It's still uncomfortable, but at least you're at home and not in a strange place. And we get the results back in a week. And so it's a great service that we use.
That's way easier than way back in the day
Oh
when we
yeah,
had to go do
for
an
sure.
inpatient sleep study. Hugely.
The issue is getting people, once we've identified sleep apnea, is getting people to wear the device. And so
It's
that's where,
tough.
yeah, it's compliance.
Sleep, I mean, I assume, has it come a long way? Because it's been a long time since I've been working in respiratory. But I mean, when I was working in respiratory, it was absolutely miserable because I had sleep apnea, but mine was I was one of the rare truly obstructive, and I had the UP3, so they cut out part of your soft palate, right, and made your my airway bigger. I was retested post that twice and was cleared, which for me was really really lucky. But that was a miserable surgery as an adult,
Oh, I can imagine.
and my understanding is it's not high effectiveness, but in the rare instance, like for me, it was helpful because I had a hard time with CPAP.
Yeah, I think there's some really good sleep experts who can go in and they do a full exam besides the sleep study. They look at other
Hmm.
things as well. And so we know when to use our resources for sure.
The referrals,
Yes.
super super helpful. So, what else do you think? I mean, as you have gone down this journey as a woman post 40, what are your go tos? Like, what do you tell women who are starting to go down that road of it just being this progression?
What I've learned over time is I can't be the person telling people that they need this. They have to want it. And so
Mm-hmm.
if you and I were sitting at the table and, someone overheard and I gave them my whole spiel on all the reasons why they should do hormone therapy, it's not until somebody actually truly wants it and is ready at that point in their life where they're ready to feel better that they'll be a good recipient of the information. And so I think that one of the things that I've currently started is something called the practice. And
Uh-huh.
really, it's to be an advocate, not just for women. I mean, this includes men as well, but to lead with passion, to be to have perseverance in what we do, and then to also just really move forward with purpose. And so I think a lot of the times that's what's happening in healthcare is we're not being listened to, we're not being heard, we're not taking the time to actually figure out what's going on with the people, with our patients. And so the purpose practice is designed to be a platform to help almost for advocacy and really to help people live a healthier life in whatever capacity that means for them. I mean, there's so many studies now that show, diet and exercise and hormone therapy and peptide therapy. I mean, there's just so many great things coming that I just hope that we can share as much resources with people as possible.
Love that. I mean, that's the entire point of really of even this whole podcast is how do we talk about some of those things? How do we share information? How do we all move forward? And how do we find help when we need it? And I have been so passionate about peptides and hormones now since it has so dramatically changed my life over the past 2, 3 years. I mean, I feel like my entire life has changed of a path that I was feeling so frustrated on and having such a hard time getting help with. And it can be really expensive if you're starting to kind of even go down that journey, right? Like getting to people who are educated, who know what they're doing, who can offer a approach that isn't going to be so detrimental financially, right? Like there's a lot of help out there now um that I feel like because I get asked that so much. Okay, well, you're starting to do all the hormone optimization, peptide therapy. Like, how much are you spending doing this a month? Like, is it thousands of dollars or what are we talking? Like, I think that's important to kind of better understand as well. Like, where do people start? What is the most important key things to kind of start with? And then where do they build to?
That's a tough one because what worries me a little bit about what's happening with hormone therapy is
Uh-huh.
just because people can doesn't mean they should. And so
Uh-huh.
I think you could go to a lot of places nowadays that offer hormone therapy, and whether the price is, really low or really high, it's really about the quality of the provider and of the care that they're giving. So when you talk about like costs and things like that, it is a little bit of an investment in your health.
Uh-huh.
We are investing to live in a healthier life. The other issue is like the quality of products. There's so many people who are compounding medications that you really just want to make sure that whatever you're injecting or whatever you're doing is a quality product that's not doesn't include fillers and ingredients that we really don't need. And so finding reputable sources for injectables or peptide therapy is really so that price tag can vary. I mean, it's different for everyone depending on symptoms, depending on goals.
Uh-huh.
So that could vary completely.
And it seems like there's also like you can take it in stages. Like I always try to remind people that you don't have to go all the way, it's not Alice falling down the rabbit hole. Just take it in pieces and start with even just getting your hormones optimized and then start looking at your diet and your lifestyle and do you need to add in therapy? Do you need because I think those I love that you guys are incorporating therapy into the mental health aspect because I that is still there's still so much taboo. It blows my mind when I still have discussions with people like, well, they're not going to therapy because of the taboo behind it. Or my family, even teenagers. I have so many conversations with teenagers. They're like, well, my mom and dad wouldn't let me go to therapy. And I'm like, how is that possible in 2025?
I know.
Is such a key, it's such a key thing to be able to have somebody to talk to.
Absolutely. And we've connected with quite a few therapists in the Valley as well, just to make sure that we do have conversations all of the time. If the hormones don't fix a lot of the symptoms or depression or
Mhm.
the feelings of down, and we always take into consideration we have seasons, and so sometimes we have what's called
Totally.
depression that maybe we'll keep an eye on, but we're always referring to local therapists for people to get help if they truly need it. So we keep a very close eye on that.
Good. That I mean, I think that that is amazing that you guys have such a holistic view. Because I mean, maybe it's just because my mom's a therapist, my stepmother was a therapist. I've always been so open to it, but to have somebody that's just a third party to talk to that is there just to listen and help with positive perspective and help you walk through things, life changing. Even
Absolutely.
just from a life coaching
Yeah.
standpoint. I love that life coaching is becoming more and more talked about, and
Mhm.
just to have people to walk through and help us sort things out, I think is invaluable.
Absolutely.
So where do you see purpose practice going? Like what is your vision for where you guys are going? I was so excited to hear about all the work that you guys are doing.
Purpose Practice will be available. Idaho Health and Hormones is what I currently own here in Idaho. But Purpose Practice is intended to be more national and to be available across the board, for people to really have that advocacy that you're looking for. So, not necessarily life coach, but really giving people connection and good, valuable information that debunking, right? We're debunking myths. We're providing information that is meaningful and really kind of helping people feel powerful with their care, because that is part of the problem. I feel there's such a disservice to our community and to the patients who are going to some of our primary cares, or that they're not getting the proactive resources that they need. They're not feeling heard. They're feeling weak, but they're not being sent to a physical therapist to build up their muscles. I mean, we have so many resources available. It's just taking the time to spend with the patients and really hear what they're saying to be able to offer them the best options that are available. So
Huge.
per- yes, huge.
Because it's hard to navigate. Like
It's
I think
not
it's
rocket
really
science
hard to
either.
navigate the system. If
Yeah.
you haven't grown up in it like you and I have, it's really, really difficult to navigate the system and how to put it all together. It's like a puzzle, but if you're trying to do it on your own, it's really difficult.
Yes, I know. And it doesn't need to be, and that's what's unfortunate. And so it's more of it's proactive care versus corrective care. And it's really trying to show people that there's more options available to them than they're receiving. So I'm excited for Purpose Practice. It's gonna be
I think that's fantastic and so needed. And I think the more and more we start to have these conversations, I love that you are embracing the social media components and the getting education out there and, you know, diving into podcasts. And I think the more education that we can share, it's out there forever. That's one of the things that I love about podcasts is that you never know who is going to stumble upon it and get something out of it and start to be able to find an answer or move their health forward with just a little bit of research.
absolutely.
So where are you? You're in Boise, right? Do you have multiple offices or is it just one?
I have Idaho Health and Hormones, which is in Meridian, and then
Which treats men and women, correct?
men and women. I know we talked a lot about women, but this is all true for men as well. I own Legacy Primary Care, which is also in Meridian. And although they are not hormone certified, they are very much in tune with the patients and listening to the patients. So, really providing that extra time and quality of care. And then Purpose Practice will be hopefully across the
National isn't what you were talking about, like
one
being able
day.
to start having a national practice. Well, I appreciate you coming on and talking about all of the things that are near and dear to my heart as I'm unofficially trying to help connect women and men, especially on the hormone front. I get so many questions on that that it's helpful to have a really educated resource to be able to send people. So I assume that for all of those that are interested in looking at hormone therapy that live locally, what do you recommend to people who don't live locally what should they be looking for when trying to find somebody to look at hormone regulation?
Thank you for asking that. There are a lot of great certifications available for hormone specialists that are pretty in depth and give the specialist a really wide range of knowledge. And so I always tell people if I may not be a great fit for you, but whoever you choose, just make sure that they've done some pretty rigorous hormone training versus maybe a quick online course or just maybe a crash course overview because it does take a little bit of finessing. And so I think just check credentials and just make sure that your providers are trained. There's a
Is there
lot.
any credentials specifically to like think about or just look for?
I I'm personally am trained in WorldLink, and WorldLink has a website where you can go on and you can find a provider near me. And so
Okay.
of all the WorldLink providers, WorldLink has 4 classes before you become certified. There's a certification at the end, plus they do summits and they just have a ton of knowledge, a ton of research and information to back their certification. There's another one called A4M, which is another platform for learning hormone therapy, a little bit different in style and maybe some techniques. But I think those are great platforms for education for hormones.
Awesome. I think that's really helpful because I think that is one of the most important things is making sure that you are going to somebody that has the education backing them to be credentialed and certified because it's not just a one and done, and it's a lifelong now that people aren't having to consider coming off of it, that you're going to want to be able to have somebody that's educated in the arena.
Absolutely. Yeah.
Thank you so much, Cheryl. And one of these days, I would love to do a follow up part two and really dive into women and sex and what we can do to help ourselves as we age and things that we should be considering.
Absolutely. I would love to do that.
Awesome. Well, thank you everybody for being on today and to listening. And until next time, we will see you soon. It's grit, grace, and resilience. Thanks for being here.